Well, I think that then we can move into a conversation about, we're talking a little bit of a pediatric approach. You know, in one sense, the DNS approach to pediatrics is the only approach to pediatrics that I'm aware of, or that I know of, that I've been formally taught. And you don't realize it. It's similar to, learning the DNS perspective in general, where you have to take a step back and realize the pediatric approach that DNS teaches is not a totally holistic approach where the patient doesn't ever have to see anyone else besides me because I'm the pediatric practitioner. No, this is a musculoskeletal developmental neurologic approach for a particular kind of patient, and that only meets a particular amount of needs. They, of course, still need to see the pediatrician and other professionals as well. And in learning that, or understanding that, I started and we started to kind of broaden our scope a little bit and see other kind of approaches. And we've seen over the past several years, there's a certain kind of functional neurologic approach to pediatrics where they are seemingly eliciting primitive reflexes in teens, in adolescents, even adults. And they're using those as a basis of treatment. They're using it as an assessment. They're trying to even facilitate the reactions as well. And when you and I kind of first saw this, it raised a lot of questions, because I thought, well, this doesn't make any sense. How a primitive reflex that under normal circumstances is gone at 4 weeks old and never seen again. Now you're telling me that you're eliciting it in a 42-year-old construction worker or a 17-year-old ballerina. This can't be. You're not able to do that. There's a reason why they're called primitive reflexes. Yet, they do seemingly elicit them to a degree. Then that begs the question, okay, well, if they are eliciting them, what are you going to do about it? What does that exactly mean, number one? Now, the functional neurology people talk about, they have their perspective, and I don't fully understand or know their perspective, but their perspective is it's a matter of how their brain is functioning that you're able to elicit these reflexes. Now, they say you shouldn't be able to elicit the reflexes. They are primitive. But if you do in an adult, then that gives us an idea of how the person's brain is functioning. Is that, that sounds pretty accurate, I think, at least in terms of that. You agree?
Yeah. Yes, I agree. Okay. Again, we may have a discussion as to the validity of what we call this, and I have no strong opinion one way or another. But I do feel that if you have undesirable movement strategies, whether you're a 5-year-old or a 55-year-old, and there is a way of reintegrating that movement strategy so that it does not disturb your overall function, then we must investigate it and look to see what is the best possible practical application that you can use. So I do not turn down anything. We might have a discussion about semantics, what it's called, why it's called that. Are these true primitive reflexes or not? There's quite a lot of literature out there that has been published in regard to this, whether it is from Lisa Goddard or Sally Goddard, I can't remember
Sally.
The name exactly. And then, of course, there is quite a lot of work done from Russian research, some German research, etc. So Their term of primitive reflex, a delayed integration of these reflexes and what it does to children or adults in hampering not only their mental capacity but their physical efficiency, is something that I think we have to look at. Whether we define it rightly or wrongly, there are treatments out there that should be examined, and we can see empirically that many people benefit from these treatments. And again, we are down to the fact that, okay, like anything else, the question is there anything better out there than these treatments? How good are they? And who knows how best to apply them? And if the outcomes are good, then we should have an understanding of what is going on. As always in the scientific process, the hypothesis may or may not be correct. But if the phenomenon is reproducible, measurable, and has some logical explanation, then it is still scientific. And so I'm excited to read about these, and I've known people who have benefited from such treatment and who would not have had any treatment, who would not have had anything to help them at their age. So that's important.
Well, I think this is why you and I are a good team, because I'm the more
suspicious.
You're skeptical, but suspicious. I don't like the tone of your voice when you say that. But yes, suspicious is fair. I'm the more suspicious, and you are the more, yes, let's open. Let's try this. Let's see. And I'm always saying, but what about this? And what about this? And that's good. But I guess you explaining what your explanation just now again triggered that old thing that we've been saying, where the technique itself is not the important thing. It's the assessment of the technique. And I think, frankly, this is why I have a bit of, not a problem with it, but skeptical, because if your assessment is an elicitation of a reflex that I already don't believe should be able to be elicited because you're 40 years old, or the way you are eliciting it, I have never seen before. That's not how you elicit that reflex, or at least that's not how I've been taught to elicit the reflex. Then I do start to question and say, okay, well, I have no way of testing whether or not your treatment works, because I don't even agree with your initial assessment anyway. If you're triggering a reflex in a way that I've never seen before and calling it a known reflex that we've all seen, then I'm going to need more explanation. But and it's not all like that. They elicit reflexes in the same way that I elicit reflexes and do their treatments. But
again, I am not qualified to speak on this. What I do know,
and I'm not either, because I've never taken the course.
That's right. All I do know is that it is an interesting phenomenon to see. That whatever my provocational test, you can call it what you like. You can call it
that is
marshmallow testing. Right. It really is irrelevant what you call it. The fact is, I'm presented with a person or an entity. I provoke him in a repeated way, and I get a repeated response.
Right. Whether or not that you want to call it a primitive reflex.
Whether you want to call it that or not, or whether we all agree that it is or not. Because again, here you are telling me that you do not believe. Belief has no room in this.
Good.
It really
good.
does not.
Call me out. That's right.
I'm sorry, but belief has
do
no
not let
room.
me say the word. That's right. I agree.
Yeah, it has no room in this.
And now again, you're saying this, and it reminds me of the ATNR, the asymmetric
right.
tonic neck reflex. From DNS's perspective, is one thing, and we elicit it in one way, and we categorize it as pathologic. Whereas in almost every other realm of pediatrics around the world, it isn't what DNS is describing.
That's
and
right.
it conflicts if you don't. It conflicts with the standard definition.
That's
if
right.
you don't fully explain what we're doing and why we're doing it,
That's right.
and why we're calling it an ATNR.
Yes.
Immediately hands go up and say that's not an ATNR.
That's
And
right.
I've had that experience teaching the pediatrics courses
That's
where
right.
I show the ATNR and the DNS perspective on it, and the people who's had some pediatric experience say, well, that's not an ATNR. That's not how it is. That's not how it's taught. That's not what it's done. But after hearing the way we're defining it and describe it, they agree and say, okay, that is a pathologic response.
That's
right. It just might not be exactly what we call an ATNR. So there you go.
So I think that we need to look deeper into because after all, we always speak about the fact that these primitive reflexes are integrated. They're not lost. They're integrated and suppressed by higher centers.
Right.
The logical conclusion would be if the higher centers are stressed enough, they lose control of that. We see it all the time. We see it in posture. We see it in movement. So why should we then suddenly object to it in terms of reflexes?
You got me.
Makes no sense. So I am open-minded. I'm very interested. I think it is something that beggars investigation and if possible, assimilation, meaning that if there is something there that can be used to improve, then, as always in research, it is this approach or this technique better than this technique in affecting this outcome? And that could go on for a while. And is really then becomes a question of, is any approach better than a placebo? And then is one approach better, or is it better used in a certain population or under certain circumstances, and another one better under another set of circumstances? This is often the case we see. Yeah. We don't often end up with a black and white, no, do not use this no matter what. There are very few times when we can categorically come and say, like medication, don't waste your time. Just like we got with that cold medication that has just been taken off the shelves because it turned out to be absolutely useless. So there we are. But when it comes to treating these multifaceted problems, we have to be open-minded and examine the background against which they were developed, the literature, the research, and so on. And so, as I said, belief does not enter this arena.
I agree. But I'm going to be there to remind you that you do want an open mind, but not so open that your brain falls out.
My tiny brain is well secured behind a padlock. I hope it won't fall out, but it is a living in a sea of unknowns is a skill that most people should cultivate. What you do not know yet and cannot categorically deny or accept is part of the way life is. You must swim with it as it is and enjoy the fact that that is the way it is.
If you enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook at IMTR Seminars.